Hello viewers, I salute you for tuning into my channel, Gracious Pharmacist, and it's your presenter, Dr. Grace, going to talk about the race for a combo COVID-19 with the flu vaccine in 2022. So stay tuned for the facts at the end of the video, and don't forget to subscribe and comment. For anyone wondering why they are recommended to get a flu shot every year, to put it simply, the flu vaccines are changed every year, reflecting the circulating strains. But most importantly, they prevent illnesses, medical visits, hospitalizations, and death. Who is eligible for flu vaccination? It is recommended for anyone 6 months and older. For anyone wondering what populations are at high risk for seasonal flu, it is mainly the young children, immunocompromised patients, anyone with a chronic health condition, pregnant women, especially in their third trimester, then adults 65 years and older. Reflecting the typical flu activity that spans from November to April, it is recommended to be vaccinated starting in September or by end of October, according to CDC, partly because it takes about 2 weeks for the antibodies to develop after vaccination. So by November, at least somebody needs to be at least with the desired immunity to avoid any possibilities of infection. But for some exceptions, like the children and pregnant patients in the third trimester, they may need to be vaccinated in July or August. But since you're already in September, for anyone who has not done it yet, it's best to reach out to their healthcare provider or to go to the nearest pharmacy to get it done. For anyone who is skeptical about the effectiveness of the flu vaccines, it's important to know that CDC conducts studies each year to determine how well influenza or the flu vaccine protects against the flu. And regarding how effective the vaccine might be, this also varies based on how well the vaccine matches circulating flu viruses and the characteristics of the person being vaccinated. So for anyone who is hesitant to receive the flu vaccine, you need to know that each season is different, because even if the flu vaccine isn't well matched to circulating strains, it still reduces the risk of flu and its severity. So reach out to your healthcare provider or the nearest pharmacy and receive your shot. For anyone who was curious about the title of this video, here comes the revelation. Will there be a combo COVID-19 or flu vaccine in 2022? It turns out that we are still waiting due to ongoing research, but if at all a patient needs to receive both the flu and COVID vaccine, they could still receive both at the same visit, but of course as separate shots. And hopefully next year we'll hopefully have both vaccines in combined, such that in case somebody needs them in a single visit, they could only receive 1 shot instead of 2 shots. Optimizing the vaccination process is crucial in a sense that for anyone who has ever been recommended to receive more than 1 shot, it could be a daunting task to ascertain when this could happen, whether it would require planning separate visits and the like. But truth be told that as long as you communicate with your pharmacy or healthcare provider, they could plan whatever needs to be in stock, such that by the time you schedule your appointment, you could receive all the eligible shots in one single visit to give your body the desired immunity it deserves. And hopefully you enjoy the presentation, and don't forget to comment and subscribe. I'm looking forward to creating additional content for you.